start now with the first talk. It's by Dr. Praveen Vashist on screening for refractive errors and childhood myopia. So we start with the most important thing of identifying children with refractive errors. Dr. Praveen Vashist, he is the head of community ophthalmology at RP Center, AIMS, New Delhi, with a great experience in screening, in identifying and doing surveys to identify refractive errors among school children. And it would be great to learn from his experience.
Thank you, Dr. Rohit. In fact, this is such an important session in our country because refractive error and myopia is the second leading cause of visual impairment globally. And if you take younger children, 5 to 15 years of age group, it is the most common cause. In fact, it is responsible for nearly 90% of visual impairment in younger population. Myopia is considered an epidemic now. In fact, this is a report by World Report on Vision by WHO in 2019. It is so surprising that it is expected that by the year 2050, nearly 50% of the global population, 50% of the population will be myopic. It's a huge, huge number. If you see in India, currently we have a prevalence of nearly around 8 to 10% as per the previous studies. This is a systematic review analysis done by Professor Rohit Saxena and team. And this is for last 40 years. If we see the last 10-year data, the prevalence of refractive error among school-going age group is nearly 8.5% in urban areas and 6.1% in rural areas. The trends are showing that it is not only urban area, it is a disease which is increasing in rural population also. So, in fact, in 2001 in a study, we estimated that prevalence of refractive error is 7%. In 2013, we estimated it is almost double, it is 13%. And now it is, at this stage after COVID, is coming around 21%. So estimates of WHO that by 2050 it will be nearly 50%. It believes it will be an alarming sign for us. In fact, I would like to mention that WHO has taken is a global initiative for effective refractive error coverage. And we target that effective refractive error coverage in all age group, including children, should increase by 40% by the year 2030. But unfortunately, we have done even a national survey on blindness, and we don't have the data about effective refractive error coverage in our country. So it is important that we should conduct such survey, and I'm happy to share that now Ministry is planning to start this survey. So within next 2-3 months, this national survey will be started and RP Center will be leading this survey. We understand that you cannot treat myopia by working solely in hospitals. We have to reach to community. It is like iceberg phenomena. Nearly 90% of people are in community. So we have to reach to community to actually achieve this effective refractive coverage. And for screening, as per the National Program Control of Blindness is concerned, we started way back in 1994. It is a fully centrally sponsored program where school teachers were trained and they were referring children based on a specific cutoff of 6/9 visual acuity of Snellen's chart to the ophthalmic technician. And ophthalmic technician, after refraction, the spectacles are being provided totally free of cost. So this is a low-cost program, non-invasive program. All the criteria of screening are very much matching with the school vision screening program. And in fact, this is the screening card which is being used, 6/9 cutoff for the school teachers. If a child can read 3 out of 4 E's, then child is normal, otherwise child is to be referred to ophthalmic technician. The issue is that what is the actual number required to be screened? We are 140 crore now. And if we assume even a prevalence of around 8%, though it is much higher at this stage, we need to screen 25 crore children every year in our country, 25 crore. And among them, 2 crore children need to be provided spectacles every year. It's a huge number. We don't have manpower, we don't have infrastructure to achieve these targets. If you see the current achievement in the National Program for Control of Blindness, The program has just revised their target from 9 lakh to 15 lakh. That means from 5% of the need to 7.5% of the need is the target which has been taken by the National Program for Control of Blindness. And you can see this picture. Even these targets are being not met. If I take country scenario, even only in Gujarat, 33% of the national targets are being achieved in Gujarat alone. So you can think the rest of the country. In Bihar, it is 0% target is being achieved. This is the status in our country. And what we need is, besides school, we need to use another type of manpower for this vision screening, and probably ASHA workers well suited for this thing. We have done a PhD study how to involve ASHA worker in strengthening primary eye care. And we believe that ASHA worker can use this screening card. If not 6 by 9, it is better to use 6 by 12 or 6 by 18 card. And they can screen the entire population, includes those school-going children, for visual impairment in their respective areas. We have more than 1 million ASHA workers in our country, and one ASHA worker is working for every 1,000 population. Probably this is one area where we can look for screening for refractive error. The third component, important strategy, is having vision centers. Vision centers are primary eye care centers. In 2004, when Vision 2020 India launched in India, they targeted that by the year 2020, we should have 20,000 vision centers in the country. This is one important area where we need to work on. The Government of India is also trying to develop primary eye care facilities in terms of vision centers, and even further below in form of health and wellness centers. So vision centers probably is one important strategy by which we can think of achieving universal eye health coverage, including the screening for myopia or any other type of refractive error. In fact, for presbyopia, I believe the spectacles can directly be provided by ASHA workers. We have used this in RP center. We have 27 vision centers, and you can see in last 10 years, we are able to screen more than 6 lakh people in community-based program and have provided spectacles to nearly 50% among them. For vision center, we need to understand it has to be available at, I think, every primary health center and community health center in the country should be converted into vision centers. And we should look for public-private partnership to achieve this thing. And even the school vision screening program can be integrated with the vision centers, so that all the children who are being screened by the teachers, they can refer to the ophthalmic technicians who is available at the vision centers. In fact, this is one comprehensive integrated methodology by which all of us are working together, whether it is government sector, private sectors, NGO sectors, all together, so that we can achieve the target of nearly 2 crore spectacles every year for the school children, and another 3 crore spectacles every year for the adult population, including presbyopic spectacles. Thank you very much. Thank you.
Yeah, thank you, Dr. Vashist. That was very well spoken.